Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Welcome back, everyone. We're here today with our first Cabral HouseCall of the weekend. Thank you so much for joining me here on this Saturday. If you are joining live, I truly appreciate the support. Look forward each and every weekend to answering our community's questions. So every Saturday, 6 questions from the community. Every Sunday, 6 questions from the community. Over the weekend, 12 total questions. And as always, they are answered in the order that they come in. My team's done, I think, a really nice job at revamping the Ask Cabral page. So if you'd like to get your question answered, you can certainly go to stephencabral.com/Ask Cabral, no dashes or anything. And it tells you basically, if it's a customer service issue, please email this. If it's a question that you want answered not in 6 weeks, that you want it answered in the next day or two, submit it at cabralsupportgroup.com. And so there's all different kind of parameters to best help you. So that's that. And the first question today, I just opened up my document, is coming in from 11/25. We are in the new year. It's officially January 8th. So again, if you asked your question November 25th or before, it is going to be answered today or has already been answered. And you can find previous shows at stephencabral.com/podcast. All right. Last thing before we dive into the questions, because I'm sure they're going to be amazing, is you can follow along with the questions at stephencabral.com/2164. All right. First question today is from our friend Lorena. Lorena says, "Hi there. I'm a 28-year-old Vata and IHP Level 1 and 2 certified. Recently, I've been noticing that my Oura ring has constantly been telling me that my heart rate has been elevated at night. My HRV, as a result, is much lower than usual. I haven't gone one night of a normal heart rate, and it's been in the red in the Oura, 56 to 62 beats per minute. At the same time that this started happening, I started to feel something weird neurological symptoms to those in mast cell activation syndrome. Intense anxiety, especially after eating, heart palpitations, brain fog, and more. I've also suddenly started to experience bloating and gas after whole food meals, but not smoothies. I've never had digestive issues before and did the CBO a year ago for skin issues solely. Trying to figure out how to lower this heart rate at night. I've been lower stress. I've even lowered stress massively at work and start working out intensely. Any idea what could be going on? I take a good amount of magnesium before bed and sometimes even melatonin. Waiting on stool test results because I want to rule out parasites in H. pylori. But if the latter is negative, what else should I look at?" All right, great question. So right off the bat, we want to run the stress hormones, mood, and metabolism to look at your thyroid and to look at your cortisol levels at night. So I think it's phenomenal that you ran the stool test. I like the idea. I like the mentality behind it. It's a good IHP2 level mentality. If things get worse at night, could be parasites. So I like that, and great job there. But I would run the stress hormones, mood, and metabolism. That's at, you have the link, so you know that. But for everybody else, it's stephencabral.com/labs, and you'll be able to find all the labs. Here's what I want to think about, okay? So it is very possible, since you're telling me that this is kind of out of the blue, right? Just kind of started, that your body got exposed to a virus. Could even be the virus, that is obviously going around. That is the pandemic, right? I don't like to name the virus too often because it puts my show in hot water with the powers that be. But sometimes it's inevitable. I actually have to say the word. So here's the thing. My heart rate has been elevated before when I had the virus as well as other viruses. And it actually stayed elevated for, interestingly enough, even though my symptoms were about 3 or 4 days bad, and then maybe like a week later of exhaustion, tiredness, and then, I'm obviously better. So what I want to share with you is that my heart rate was still elevated, though, for a little over 3 weeks at night. It was about 5 beats per minute above what it normally was. And all that showed was a little greater inflammation. There was a little greater stress on my body. Remember, your body went through this essentially natural reaction of creating all of these different, people say cytokines are things to watch out for, but you have to understand like that is part of the immune-based process, and that can create inflammation, but it fights off the virus or other pathogens. So anyway, what I'm saying is you may have been exposed to a virus. More sleep, more rest like you're doing right now. You're doing great with the magnesium, the melatonin. You may even look at Adrenal Soothe at dinner to help lower the resting heart rate. And if cortisol is elevated, you might make sure that you are not eating 3 to 4 hours before bed. That will certainly make a big difference. You might want to look at using 2 to 3 daily digestive enzymes with meals to see if that helps. And it's definitely, looks like there's obviously a digestive issue. So let's run the stool test. Let's see what comes back, see if we need to do the CBO protocol again, or if not, the modified CBO. All right? Or modified yeast bacteria program. Melanie is up next. I always hear you talk about people with high blood pressure needing more potassium in their diet. They would therefore not have to worry too much about sodium. However, my dad has high blood pressure and a few weeks ago ended up in the hospital as his potassium levels were very, very elevated and it was life-threatening. He has high blood pressure, type 2 diabetes, etc. I was wondering how this can possibly be. I thought everyone with high blood pressure usually had low potassium levels. By the way, this event happened the day after he took the laxative to do a colonoscopy, so not sure if this is relevant. It is relevant, Melanie, and I'm happy to explain this. Okay, so when I talk about potassium, I talk about dietary potassium, okay? The problem is when people have high blood pressure or type 2 diabetes, typically with high blood pressure, they're put on diuretics. Diuretics affect the kidneys. That affects potassium levels. He took a laxative. And they should have told him this, by the way. The doctors should have told him this, that if you're taking a laxative, it can cause the medication to stay in your bloodstream longer or not as long and can affect your kidneys. That should have been stated. Again, I'm not a medical doctor. I'm not giving medical advice, not giving any medical treatment plans or any medical cures on the show. But that should have been told. Maybe it was. Maybe it was. Maybe it was missed. Hey, these things happen. I understand. But I want you to know high potassium is oftentimes tissue breakdown, so a loss of muscle mass, too hard a workout, rhabdo, et cetera, or kidney disease, or being on diuretics. So again, all of this is explained actually through the medication he's on, as well as the kidney issues, as well as the colonoscopy. Okay, so that's hopefully, again, you wrote this in on 11/25, so I'm sure let's see who this is. Is this whoever it is, it's your dad. Okay, so I didn't know if it was your husband, your dad, whoever it might be. Okay, so explainable. Should have been able to run follow-up blood work a week or two later, and the potassium should be normal now. All right? So that's that. When I talk about sodium, potassium, I talk about dietary needs. That's not going to affect blood pH. That's a problem. It affects blood pH. Your body knows what to do, at a pH level of the blood. All right, Anonymous is up next. Hi, Stephen. I have a question about insulin. In the health world currently, there is a lot of talk about blood sugar and insulin in regards to losing weight. I'm regularly reading that insulin must be kept low because insulin halts fat oxidation. Fat lipolysis, yes. Therefore, if insulin is up, you can't burn fat. However, there is an abundance of research that shows that under isocaloric conditions, there is little to no difference between low carb, high fat, and high carb, low fat diets. I know you yourself are familiar with the rice, fruit, and fruit juice diet research, which was basically all carbs, and yet insulin sensitivity was improved and weight loss occurred. Surely this would suggest energy balance is the overriding important factor in weight loss. If fat can't be burned when insulin is present or high, how can such studies be explained? Would love your insights here. Thank you. Yeah, this is a really scientific question, and I'm happy to answer this. I've been studying nutritional biochemistry for a good 2 decades. This is what I love. I love geeking out on it. For anybody that doesn't love geeking out on this, that's okay. But honestly, Anonymous, I also gave you the full answer on this on a podcast I did entitled Carbohydrates Do Not Cause Diabetes. And this is one of those reasoning. So let me see if I can find it really quick for you. I'm only going to take a second, so I apologize, everyone. Oh, it's right there, 2028. All right, so Anonymous, I answered this question at stephencabral.com/2028. It's basically 25 minutes on me sharing with you why sugar and carbohydrates do not cause diabetes. Processed food Hydrogenated oils and fats, yeah, they cause diabetes, no doubt about it. But fruit, no. Rice, no. I mean, that's just not the way that it works. So-called experts would love to tell you that, but again, anonymous, you've done the research. A lot of these social media experts, they haven't done the research. So that was a 25-minute show. I can't give you a 25-minute answer, but here's the difference. I'm going to break this down very succinctly. We have high-fat diets, low-carb. Okay, when it's low-carb, you're not going to get as much blood sugar spike, if any, really, and you're going to have fat as a predominant fuel source. Okay, so you're going to be able to tap into body fat as long as the calories are low. Isocaloric, low-calorie diet. We'll just call it that. Okay, so you are taking in less calories than you are burning, therefore you're going to be losing weight. I'll give you the caveat at the end because that doesn't always work for everyone. Now, the next diet, so that's easily explainable, right? Easily explainable, blood sugar's low, insulin's low. If those are low, the body then knows to tap into body fat. Perfectly explainable. However, there are plenty of people on, 95-5 diet, which is like 90% carbs, and they're still losing weight. How is that? Well, that's high carb, low fat. This is the big conundrum that almost nobody wants to admit. You can be high fat or you can be high carb, but you can't add high carb, high fat together. And you can't do high carb, high fat. Obviously, it's the same thing together. You have to make sure that when you're eating a high carbohydrate diet, that it's also not high fat. There's an issue that happens with these cell membranes and the storage of fat when you're eating fat. So this is mainly oxidized fat that's the issue, and I've talked about this on my show. You disrupt the cell membranes. The cell membranes are not made of carbs, and they're not even really made of proteins. They're made out of fats. It's a bilipid membrane. If you disturb the bilipid membrane with oxidized omega-6 fats or too many sterols, then you are going to disrupt the amount of sugar that can get into those cells, insulin. So let me put this even more. I know that wasn't succinct at all, so I don't want to say more succinctly because that wasn't succinct. What happens is this. On a low-fat diet, purely carbs, and it's low calorie as well, your body is very easily, after a period of weeks, able to shuttle the glucose that comes from these carbs into the liver and into the muscle cells. So it's stored away. But you're also now hypocaloric. So now you're able to tap into body fats or glucose whenever you need it. So you have to understand is when there's too much calories, it's going to be stored as body fat. It's easy to understand because that's a storage place, right? So your body's going to do what? Well, when the heart rate is low, when your body's in more of an aerobic state, it's going to tap into body fat. So you might say, well, why doesn't all of the extra carbs just go to fat? Well, first of all, you're hypocaloric. You're burning more calories than you're taking in on a daily basis. So when you're in even a balanced state where you're using some glucose and some fat, well, you're taking more from fat and glucose. So when you take in more glucose, what do? Well, you fill up the glucose sites or glucose storage facilities like the liver and the muscles with glycogen, and then you fill up, you create additional adipose tissue. But it's a negative balance, but because you're burning more fuel. So then you're going to take more of the glucose that was just stored and you're going to lipolyze more body fat, right? So you're going to be burning that as well. So you can lose weight in either place. So you are completely correct in both. The only place where you went wrong is the belief that it's all about energy balance, because that is true. However, when you're in clinical practice, you will see people on an 800 calorie a day diet still not lose weight. And that goes back to, yes, energy balance, but what happened to create such a low energy balance? Because you don't want those people eating 600 calories a day, 400 calories a day, right? So what happens is thyroid, sex hormones, adrenal. I don't want to get too deep into that today on this, but that is what happens. That's why people stop losing weight. I've talked about this before. Run the stress hormones mood and metabolism test at stephencabral.com/labs, or ideally the big 5, to be able to figure all this out. So good question, Anonymous. Really long answer, so I apologize. I don't know if I'm going to be able to get to my 6 questions today because of it, but it's a good answer. And so, it's a good question, so it deserved hopefully an adequate answer. All right, Amber's up next. Hello, Dr. Cabral. First, I just wanted to say thank you so much for all that you do and give. I'm currently getting my level 1 IHP certification, and I truly look forward to learning from you every day. So in regards to my question, my 7-year-old son got COVID about 3 weeks ago now. He got hit in the form of mostly diarrhea for 2 days. I'm only giving that piece of info because the current problem has only happened since having said virus. in his 7 years, he has been sick about 4 other times. He's been hit with the current problem about 3 times in the last 2 weeks. He'll be eating and his stomach will start to really hurt bad. One was on Thanksgiving, which I thought, okay, maybe all different foods being combined. Then it happened again today, 2 different times after eating foods he normally eats. Didn't hit him as hard, but still came. His stomach doesn't seem to settle once I give him his ginger drink. My mom intuition tells me something isn't right and I need to catch it before it develops into something worse. I have some ideas on where to start, but I'd love to get your thoughts first. Greatly appreciate it. Thank you very much. Well, I'm happy to help, Amber. Yeah, this all makes sense. So what happens too is that there is an inflammatory-based issue that does happen with this virus, and that it can affect the gastrointestinal tract, and specifically inflammation there. I spoke about that not just in the obesity-based episode, but how inflammation in one of the specific forms is interleukin-6 can affect the mucosal sites, and that includes the digestive tract. So what could have happened is there could have been a rebalancing of bacteria in the gut. And I don't like to go overboard. So at first, maybe we can just do the clean gut probiotic. Son's 7 years old. Again, I'm not giving any medical advice, but he might do 1 capsule a day upon waking or 1 before bed. And we see how that does for a week or 2 and see if that greatly improves the digestive tract. Might be a good place to start. If it was my child, I would probably start there because it contains Saccharomyces boulardii and some good bacteria for repopulating. If it makes the diarrhea worse, well, certainly that could be a pushing out of some type of pathogenic bacteria, we would certainly want to slow down or stop that probiotic. If it didn't improve, as an IHP, you know that we're going to run the bacteria and parasite stool test. That's what I recommend. All right. And if you can't do that, although I would recommend it, I would run the Candida metabolic and vitamins test. All right. Keep up that good work. Iwa is up next. Hello, my son, Isaac. Maybe 18. I might be misreading this, so I apologize. Can't seem to get his full voice back after he caught a cold early fall, which happened around the same time last year. It's really bad, especially in the morning when he has to cough and clear with phlegm and scratchiness. The ear, nose, and throat took a picture of an inflamed vocal cords, lots of phlegm, and gave him antibiotics and steroids. He felt better for a week before it came back. He's working outside around damp leaves quite a bit and other mold-based symptoms. Since he was a little puppy, his colds always got to his lungs and airways. What do you think, Doc? What's going on? Much appreciation your way, Iwa and Isaac. Okay. Well, her son is a little puppy. I know we're talking about a son here, so not an animal for anyone that's caught that little tongue in cheek. So here's what we want to look at. This very well could be postnasal drip, and it could have to do with mold, the dampness, allergies, etc. Especially if it's worse in the morning when you wake up. Postnasal drip is greatest overnight. What happens is you've got these sinuses behind your eyes, right beside your nasal cavities. They connect behind the nose, and behind the nose, it can drip straight past your mouth, down your esophagus and also larynx, and it can go affect the vocal cords, of course, because what happens is that in the lungs, which is why he's coughing it up, what happens is there's white blood cells come to the area to fight off this mucus and pathogens that creates inflammation that can create all the symptoms that we're speaking about here. So I think this is it. Again, I'm not giving a medical diagnosis, but really now we're talking about, okay, how do we get rid of the postnasal drip? You know, for me, I don't know how old your son is. If he's 18, he can certainly do at least the daily nutritional support and the immunity protocol, right? So if he's not doing vitamin C, zinc, vitamin D, certainly he could be doing that and could be doing the daily nutritional support shake. And then what I would look at is doing the neti pot. So the neti pot, what I do myself is 2 drops to 3 drops of the citricidal. I do a little bit of the Himalayan sea salt, shake it up, and then I just pour through the nose and pour through the nose. He should do that every time he comes back from working outside with the damp leaves or the moisture out there, and in the morning. So that's exactly what I would personally do. And then I would maybe use the Nasacort spray, 2 to 3 squirts on each nostril twice a day. And I would probably do the Nutribiotic throat spray as well, 2 to 3 squirts twice a day. Again, that's what I would do, see how it works. And if not, we need to look at much deeper underlying root causes, such as the mold, mycotoxins test, organic acids test, etc. All right. So hopefully that's helpful, and good question, but we've seen this hundreds, thousands of times, and hopefully this is very helpful for you. All right, let's do one more question. Let's get in our 6. Melinda's up next. I've read in medical studies of children who contract the chickenpox virus are less likely to contract shingles later in life, which is so much worse. Is this true? What is the best way for them to catch the chickenpox now that so many children are vaccinated against it? What can parents do to avoid their child from contracting painful shingles later in life, as well as naturally boosting myself? Okay, well, yes, that's true. So that is true. Yeah, chickenpox as a child, much less of an issue when you're an adult. The real issue is for pregnant women. That's obviously the big issue. So shingles virus is also a herpes-based virus, essentially, and I don't know how that you can contract chickenpox, so I'm going to refrain from answering that question. If you don't get chickenpox, you don't get chickenpox. Of course, if you wanted the natural immunity from chickenpox, back in the day, they sometimes had chickenpox parties. They had measles parties. I'm not saying that you should do that, but I want to say that's what people did, and sometimes it happened back in the day. Okay, now you can still get shingles even if you had chickenpox, so I don't want to say that you can't get that either. What I can say is this, is that there are shingles protocols. I have a podcast called How to Destroy Essentially the Herpes Virus. I think it's like, I usually have it memorized, but I don't have it memorized right now for whatever reason. I think it's StephenCabral.com/762, but I don't know if that's true or not. Michelle is really great inside of the CabralSupportGroup.com. So I would actually go in CabralSupportGroup.com, and ask Michelle for that podcast on how to destroy herpes viruses. All right. So that's what I recommend. On an everyday basis, I recommend the Daily Foundation Protocol plus the Immunity Protocol, which is vitamin C, zinc, vitamin D. All of those are great as well for maintaining a healthy immune system. I know I didn't answer your question perfectly. We're going to send you back over to get that podcast on how to destroy viruses. You know what? I don't feel like I gave it to you properly. So here's what I want to do. I'm going to find it for you because I don't want to leave anyone hanging. StephenCabral.com. Stephen Cabral, how to destroy virus. And it should pop up. There, I wasn't too far off. Episode 760. There it is. StephenCabral.com/760. We'll have your answer, Melinda. Thank you so much. Thank you, everyone. That is my time for today, but I will be back tomorrow answering 6 more of our community's questions. Have an amazing weekend. Thank you so much for tuning into the show. Hopefully you got a lot of value from it. That is my goal every single day, is try to share with you something that I've learned over the past 25 years that has helped tens of hundreds of thousands of people all around the world. And what I want to do is also be able to share with you things that I use in my practice that I think you may find useful as well. One of those is vitamin D. And I really like the liquid vitamin D. It's one less capsule to take every single day. And you can actually just measure it by drops, which is really easy. So someone like myself and most people in our practice, they do 4 drops right under the tongue every single day. I do mine with my smoothie in the morning. It makes it really easy. And this vitamin D, 1 bottle lasts you about 3 months, sometimes even 4 months, so it's pretty convenient and easy to have around. What I'd like to do is share with you a free bottle today. So on all qualifying orders over at Equilife, we'll actually add to your order a free bottle of vitamin D. It's going to be about 3 or 4 month supply if you're using about 4 drops per day. That's the average adult use. You might use a little bit less. You might use a little bit more, all based on your vitamin D testing. So if you haven't tested your vitamin D, you're also welcome to do that at StephenCabral.com/labs. Click on that vitamin D lab. But today, you might as well get yourself a free bottle of vitamin D. It's about a $39 value. You can get it yours free on all qualifying orders by heading on over to StephenCabral.com/shop. Take care, everyone.